Hello, I am Dr. Livaditis, a prosthodontist practicing in Baltimore, Maryland. I developed and reported on the matrix form core procedure in 1997 and have been using it regularly for over 30 years. The matrix formed core system enables the dentist to create a custom shell supported by adjacent teeth to form a composite foundation and to proceed directly to the crown preparation. MFCs are applicable when substantial tooth structure is missing. Indeed, the greater the amount of coronal tooth structure missing, the more valuable the MFC technique becomes. MFC procedures are effective when crown margins are difficult to access. Auto-cured composite is the material of choice. It is the preferred method for a single core, but the real value is multiple cores that can be done simultaneously. Contraindications are when minimal coronal structure is missing, there's no advantage to fabricating a matrix. MFC is designed for crown foundations only. The MFC system cannot restore proximal contacts with adjacent teeth. Let's start with the indirect matrix method. There's substantially tooth structure missing. Each tooth requires a core as a foundation for a crown. The crowns will eventually be subgingival or equigingival, and all maxillary anterior cores will be completed together. Let us begin with the indirect method for forming the matrix. You prepare a wax-up or a computer-designed cast with slightly oversized cores. The matrix will be made over the wax-up or computer-designed model. And at this point, you may want to prepare for a template or a shell for the interim crowns. To fabricate the matrix, you use a high viscosity impression material or occlusal registration material. The matrix must be semi-rigid and removable past infrabulge areas. You extend the matrix one tooth beyond the cores, hopefully on both ends, and you trim the matrix to the gingival crest. The reason for trimming the matrix to the crest of the gingival tissue, is illustrated by this example of fabricating a temporary crown. The shell on the left extends over the gingival tissue and collapses the tissue against the tooth, compromising the registration of your finish line, and if there is a slight sulcus that is open, compromising that. The illustration on the right shows you that the resin, using the same shell trimmed to the crest of the gingiva, changes direction at that level. Now you might say that that change in direction is due to the resin hitting the crest of the gingiva, and that's partly true, but it does register your finish line, and if the sulcus is slightly open, will register that area also. Now you complete the occlusal reduction on the teeth. In this case, it's not necessary. You trim the axial walls to the preferred taper. You prepare your finish lines on intact tooth structure, but slightly shy of your planned crown margins. You remove caries and unreliable restorations, not necessary in this case, and you add pins or posts for retention and resistance form. Now, since the matrix and the teeth are ready for cores, you prepare the enamel and dentin for bonding and adhesion. You apply the current dentin sealants and bonding agent. You fill the matrix with composite, and you syringe the composite around the pins and crevices. You want to avoid trapping air, blood, or saliva in the cores. And you ensure excess composite to flow beyond the matrix. Now, you want to consider how many cores you want to do at a time. In this case, we have a total of 6. The number of cores may vary with each dentist. You want to consider the composite properties and limitations. For example, the adequate mixing time for a thorough mix, how much working time you have to fill the matrix, syringe resin around the pins and into crevices. And you want to be aware of the setting time to avoid poor adaptation due to the setting resin or even possibly incomplete seating of the matrix. In this case, we did it in 2 segments, and both segments are completed. The 2 segments is a minor increase in time over doing it all at once. Note the excess resin, ensuring no voids. And the excess resin is easily sheared near the core margins. At this point, you want to evaluate whether any core is deficient for whatever reason. And if you find one deficient, let's say that one core is inclined slightly off. You revise a matrix with internal trimming. You apply bonding agent to the deficient core. You add composite in the revised matrix site, and you reseat the matrix and allow the resin to set. Now this is the best time to do that because your existing resin is fresh and clean. You then refine your crown preparations. You relocate your finish lines to the preferred crown margins. And at this time, you can prepare and insert your interim crowns. Now there's a special note here. You may note that the pins are slightly exposed, and you might consider them to be compromised. That's not true. They are still very functional and very retentive and provide resistance form. Let's look at an indirect method for light-cured composite cores. You prepare a wax-up or computer-designed cast of slightly oversized cores. You create a thin, clear, vacuum-formed shell of the designed cores. You trim the shell to the gingival crest, especially with subgingival cores, and you use either auto-cured or light-cured composite. You excavate caries and remove unreliable restorations, which in this case it's not necessary. You trim the crown preps with finished lines just short of the final crown margins. You add retentive pins and posts. You syringe resin around the pins and crevices. You fill the matrix with composite, seat it, and then you apply the light to cure the composite resin. Now to continue, you relocate preparation finish lines to your final crown form. You refine any other aspects of your crown preparations. And the reasons for clear matrix and light cured resin is that you're able to select a core shade to match the abutment tooth. And it allows you to use restorative composites for cores. Now let's look at a case that for which this technique was created. This is the direct method for matrix cores. This type of case prompted the development. In major cases, quadrant cores are possible. And all posterior teeth, in this case, require cores and crowns. And all cores are to be formed simultaneously. So let us proceed. You prepare the teeth for crowns while visualizing the teeth to be intact. You begin with occlusal reduction for the crowns. You prepare axial walls to the preferred taper, and you locate crown finish lines on intact tooth structure, but slightly short of final crown margins. Now you have an option. You can momentarily retain unreliable restorations and demineralized dentin. You proceed to form the matrix. You use a carrier to include an additional tooth to serve as a vertical stop. You use a viscous body, BPS, or polyether material, or a semi-rigid occlusal registration material. At this point, you have the 2 options. On the left-hand side, you have existing tooth structure, you have existing restorations, and demineralized dentin. On the right side, you've eliminated all those and have created the equivalent of cylinders. On the left-hand side, we'll refer to that as landmark version. Both methods are trimmed to the gingival crest. Both should include vertical stops. Both methods enable effective cores, and both methods allow aligned cores for splinting of teeth. The one with the landmarks gives you intact areas which serve as valuable landmarks for trimming. You have less trimming of the matrix, less trimming of the core resin over intact tooth areas, and you have very good vertical stops if you do not trim the areas that result from occlusal reduction for the crowns. They're very effective vertical stops. With the cylinder method, you have larger cylindrical cores, more trimming of core material. The positioning of the matrix relies on the adjacent intact teeth. The vertical stops rely on the adjacent teeth. And this system, though, allows correction of tilted or misaligned teeth. You then proceed to prepare your crowns further. You excavate the remaining caries. You remove unreliable restorations. You provide the necessary retention, including pins and posts. And you finally confirm that the pins and posts do not interfere with seating of the matrix. You can bend the pins inward towards the pulpal space. You then etch the enamel for bonding. You prepare the dentin for adhesion. You apply dentin primers and bonding agent. Now, I don't discuss materials here because I don't want to make this presentation obsolete when the newer materials are introduced in a year or two. You then syringe composite around the pins and posts. You fill the matrix with the autocure composite. You seat the matrix filled with the core material, and the excess resin should be evident to prevent voids or trapped air. Considerable excess resin here, but don't let that concern you. All that flakes off quite easily right at the crown margins, at the core margins. You check form and alignment of the cores, and you make corrections as described previously. You then relocate your finish lines for final crown margins. You refine your preparation, and the cores are complete. Now you have a nice opportunity here to make a matrix for the matrix impression technique, which I described in another presentation. And you can fabricate and insert the interim restorations. Now let's look at the isolated or even short tooth. Imagine this tooth to require a cord. These slides are actually borrowed from the matrix impression system. You extend the matrix 1 centimeter mesial and distal to serve as a vertical stop upon seating the matrix. And you extend the matrix 4 to 5 millimeters onto the facial and lingual of the alveolar ridge to prevent rotation of the matrix during setting of the resin. Now let's go over some important considerations or to serve as a review of what needs to be done. The matrix material should be semi-rigid, either an impression material or an occlusal registration material. Now imagine for a second if you used resin to create your matrix. Well, it's once seated and once set up, it would take you the rest of the morning to remove that matrix. It needs to be semi-rigid so that you can remove it without tearing or breaking the matrix. The matrix material should not be too elastic because as you try to trim it, it just bounces away from the burr or abrasive stone. The core resin should be auto-curing unless you use the clear shell described earlier. You should include definitive vertical stops either by adjacent teeth or by the occlusal reduction created early on, where you do not trim that area in the matrix. And you syringe composite around pins, posts, and crevices to avoid entrapment of air. You use excess resin to extrude out to prevent hidden voids in the cores. And you correct a deficient core at this time while the resin is fresh and clean. Now there's a very important advantage to the matrix core system, and that is that it stabilizes. It stabilizes the core method by the adjacent teeth. Imagine if you were using a crown shell or a crown forming shell to do your core. You have to hold that in place, position it properly, and hold it in place until that resin sets up. The matrix impression does that for you, and it can do it for all 3 or 4 cores at the same time, unlike 3 or 4 individual core forms. So that's a really good advantage. If you want further information, you can review the Crown Foundation article published in the Journal of Prosthetic Dentistry. Also look for other topics and procedures that I've introduced or been involved with. I'm a co-developer of the Maryland Bridge technique along with Dr. Van Thompson, and I have several segments out there on the introduction of the bridge, also the design of anterior and posterior bridges, along with the expansion of the technique to include inlay, onlay, and etch metal restorations in bridges. Also, I described the etching of the metal and gold plating the etch surfaces. I've included the expansion of the technique over the decades, and I even provide information with 40 to 45 year follow-ups of bridges as long as 8 to 10 units. You may also be interested in the patient-induced posterior dental intrusion. I provide diagnosis and etiology for it. It's a new explanation for acquired deep bites, also for worn anterior teeth with no proportional posterior wear to explain the anterior wear or the deep bite. Also these cases are sometimes explained to be worn anterior teeth in occlusion, exhibiting compensatory eruption, and without a change in the vertical dimension, which I disagree with strongly. And it's explained more accurately by the patient-induced posterior dental intrusion condition. It also explains some occurrences of mandibular anterior crowding. There's about 8 or 9 theories to explain it. The most obvious one is posterior dental intrusion. PDI, posterior dental intrusion, is a new category of collapsed bites along with missing posterior teeth, erosion, abrasion, attrition, and I'd like you to compare it to posterior bite collapse by Amsterdam. The two have 1 or 2 features that are they're comparable, but other than that, they're complete opposite conditions. Very interesting. Also, matrix impression technique. It's a new technique. It doesn't compete with scanning or computer designed restorations, but it does compete with conventional impressions. And although it uses some of the favorable features of other impression techniques, it also challenges some of the concepts and procedures. The matrix impression technique relies on hemodisplacement at the critical moment versus hemostasis. It provides a stronger sulcular extension of the impression. It reduces tearing. It delivers the material into the sulcus better than syringing. Not quite as good as a copper tube impression procedure, but it delivers it into the sulcus effectively with gentle force, and most importantly, all the abutment teeth simultaneously. Now, if you're trying to do an impression with 8, 10, 12, 14 abutments, I'm not sure that you have enough working time with the conventional with the current impression materials to properly syringe around all those teeth and deliver the tray. The matrix impression technique delivers the material simultaneously. Thank you very much for your attention.